I'm kind of in this mood of talking about acute painful events, things that will kind of make you tear up, but you want to know what to do correctly to save someone's life. So let's talk about acute coronary syndrome. Now, when we talk about acute coronary syndrome, this is someone who comes in with what complaint? Chest pain. And of course, the key thing is to get them to the hospital as quickly as possible. And who helps us out when we have these acute coronary syndromes? Our amazing paramedics, our amazing EMTs that are grabbing the patients and bringing them to the emergency department. And of course, if you want to know what is the best first initial diagnostic test for someone who screams the word chest pain, well, 3 letters have to jump to my mind. ECG, electrocardiogram. It's very important because you want to diagnose one of 3 things. Is it a STEMI, ST elevation MI? Is it unstable angina, where you could have some ST depression? Or you may need to check some of those cardiac enzymes, those cardiac markers, if they have something called an NSTEMI, non-ST elevation MI. So, what is the pearl today? I haven't got to it yet. So there was an old saying, and I kind of wanted to do this because I remember when I took my board exams, when you come in with acute coronary syndrome, that there was someone who greeted you at the door, and this is supposed to be a hint to what to help these patients out with. It was called MONA. Now, what does MONA stand for? M for morphine, O for oxygen, N for nitrates, and A for aspirin, And supposedly MONA greeted everyone at the door. But you know what? It's 2021 and we don't like MONA as much anymore. And when we talk about the M for morphine and the N for nitrates, well, who with acute coronary syndrome should not get those? People who have low blood pressure. That's right. And when do you probably get low blood pressure? If you have a right-sided myocardial infarction. You may need to do what we call these right-sided heart leads, where you take these precordial leads and what you do, you just go on the right side of the heart, V1 all the way to V6. And because they have low blood pressure, things like morphine, things like nitrates will even lower the blood pressure more. And that may not be good for your patient. So Mona says give it to everyone. I say better make sure it's not a right-sided MI and make sure they have a good blood pressure. Next is oxygen. Now this is where my passion kicks in. Does everyone who has a myocardial infarction need supplemental oxygen? I set you up there, right? The answer is no. Because when you have a heart attack, is that going to prevent you from getting oxygen in your blood? Not really. So when do you want to give oxygen? And this is my tip throughout the board exams and when you rotate with me in the hospital. Let's keep it simple. Give oxygen if they are hypoxic. And let me ask you this. If you give oxygen to someone with an MI who doesn't need it, can there be bad outcomes? The answer is yes. The American Heart Association states that you should give supplemental oxygen when the oxygen is less than what? 92%. If you give it when they don't need it, they can get what's called free radicals, and they can damage that very sensitive part around the myocardial infarction. So what does Mona say? Give it to everyone. But what does Dr. Raj say? Well, give it if they're hypoxic. And the last one is going to be the A. The A stands for what? Aspirin. But in the year 2021, when you're taking your board exams, do we just give one antiplatelet agent? The answer is no. We give 2. One aspirin and the other from a category of drug called the P2Y12 inhibitors. And what are the 3 P2Y12 inhibitors you want to know for the board exams? This is the pearl, just in case you didn't follow. The pearl is going to be number 1, it could be clopidogrel. Otherwise, in the olden days, we used to call that Plavix. Number 2, it could be Tigrelor. Now it goes by the brand name Brilinta. And the last one is going to be Pasugrel. So these are going to be the actual 3 main P2Y12 inhibiting antiplatelet drugs you should know for the board exams. Now, I'm going to take it up a little notch. I'm feeling super generous during this video. So if you want to think about clopidogrel, that's going to be my go-to answer on the board exams along with aspirin. So when we talk about aspirin, it's the 81 milligram dose. When we talk about clopidogrel, it's good if you have acute coronary syndrome and got a stent, or if we treat you medically, go for clopidogrel. When we think about Tigrelor, think about it both for medical and for stent, but it is rather expensive. The last one is Prasugrel. Now that only got FDA approved for stenting. So how are you going to choose Prasugrel, or Tigerlord? The key thing is the side effects. If you've ever had a stroke or a TIA, transient ischemic attack, you cannot use what? Prasugrel. So remember, antiplatelets are crucial when we talk about managing acute coronary syndrome. Remember the limitations of MONA. I think I gave you quite a few pearls there. But if you desire more, go to my website. It's going to be beyondthepearls.net. You'll see my book collection. We have my podcast titled, oh, you got it, Beyond the Pearls. So I hope to see you there. And stay tuned. There's more pearls to come.